As you know, obesity is a chronic disease. It is a disease that, similar to high blood pressure, diabetes, or high cholesterol, studies have shown that 42% of American people are obese, and by year 2030, it's going to be 50% of American people obese. So as you know, obesity becoming a very serious condition, and it is a disease that you need help to tackle it. You cannot tackle it on your own. Now, what causes obesity? It's very complicated. Usually it is what we call multifactorial. There's a lot of things that contribute to obesity. Part of it could be genetic, part of it could be hormonal, part of it could be medication, part of it could be cultural, and also part of it is what we eat or what we are eating in general. So my message to you is, if you have the disease of obesity, or if you are overweight, don't panic. You are not alone. We are here to help you. At CMC Weight Loss, we have a lot of options for you to help you tackle this chronic disease. We have a team of professionals in our program, including me. We have 2 registered dietitians. We have a program coordinator. We have a program navigator. We have a specialized bariatric nurse to help you go through this chronic disease and hopefully to help you lose weight moving forward. Because as you know, obesity is a disease that affects the whole body. So usually it causes a lot of other diseases to happen to you if you are overweight, like hypertension, diabetes, high cholesterol, sleep apnea, joint pain, and believe it or not, cancer. Also, obesity studies have shown that it also causes some kind of cancers like uterine cancers, ovarian cancer, thyroid, breast, colorectal. So it's a lot of things that this disease of obesity can contribute to your worsening of your health in general. So that's why we here at CMC Weight Loss, our mission is to help you tackle this disease, help you to lose weight, and hopefully to make all these other diseases either improve and sometimes complete remission. We cure you from some of those diseases as we help you lose weight. What we do here at CMC Weight Loss, we have different options. It is a comprehensive program. We can do as simple as diet and exercise all the way to gastric bypass and everything. Today we're going to speak about Roux-en-Y gastric bypass, or simply gastric bypass. This is one of the surgery procedures that we offer here at CMC Weight Loss as well. We do gastric bypass laparoscopically or robotically with small incision. For you to qualify for this surgery, you have to have a body mass index of 30 or above with a comorbidity like hypertension, diabetes, sleep apnea, or high cholesterol, or you have to have a BMI more than 35 with no other comorbidities. Gastric bypass, as you can see here, what we do with the gastric bypass is we cut a small part of the stomach, we create a pouch, and then we bring a small bowel connected to this pouch, and then we reconnect the bowel here. The way it works, as you can see, when you eat, the food is going to follow the green pattern. It's going to come to the small pouch, you're going to go through this small intestine that we created or brought up, and then it's going to go down. It's going to bypass the part of this intestine. That's why it's called gastric bypass, because we are bypassing the first part of the intestine that's called the duodenum, and then the food here will meet with the juices that comes from the stomach, and digestions happen from here down. So the way this surgery works is mainly by multiple things, but mainly it is restrictive because it makes you eat less because you have a smaller pouch, and also metabolic because every time you eat, when the food goes through this pouch down the intestine, bypassing this part of the intestine, so the food goes so quickly through with low pressure system, and this will change the guts of the intestine, and by changing the guts it becomes metabolic effect where the sugar, the insulin, everything changes, and also the appetite goes down. So it works by restriction and metabolic. When you come to us in the office, we'll go over in more details with technical aspects. With this surgery, you should be able to lose 30% of your total body weight, or anywhere between 70 and 80% of your excess body weight. And by losing this weight, your health will be better. When I say better, this means the comorbidity that you have. If you have diabetes, hypertension, high cholesterol, sleep apnea, joint pain, all should improve or sometimes completely recover from that. As you see, this is done robotically or laparoscopically, as we mentioned before. You should be able to go home next day and the recovery is pretty quick. When we say it is safe, this means it has a low complication rate. Let's go about some of the complications that might happen with gastric bypass. Complications with gastric bypass could be infection, bleeding, leak, something called dumping syndrome, ulcers, gallbladder disease, and obstruction. We will talk about that later on when you come to see us in our office, but we can assure you that those complications are low in rate and the procedure is very safe.